Nice to meet you, Saranne.
Nice to meet you, Bryan. It is so wonderful to have you here, all the way from Nigeria.
Yes.
And I know that you are doing innovations. You are redesigning what it means to be a pharmacy.
We are. It's interesting in Nigeria when you think about access to healthcare. Most people pay out of pocket. So insurance penetration is only 5%, which means that 95% of people are paying out of pocket. And so for us to really try and get to those people and give them the right kind of healthcare that they need, we've got to go to the pharmacy because they mostly go to pharmacies to purchase their medicines. So the pharmacies happen to be the first port of call for healthcare, and we've got to fix it.
So you really get to know the people in the community very personally.
We do. And one of the great things about healthcare is that it's a great equalizer. It doesn't matter if you're rich, it doesn't matter if you're poor, you've got to take care of your health in some way. And so for us, one of the things that really drove us was, personally having friends, whether they come from, the more middle class parts of town or the poorer parts of town, when they have deep healthcare needs and they go to pharmacies, the quality of care really wasn't up to scratch. So we felt the need to actually go in there and try and deal with them on a face-to-face basis and try and solve it.
Well, you're right in the heart of the community. I mean, I don't think I ever speak to a pharmacist in the U.S. They're behind all these shields, and I just go and get my medicine out of a little bin, basically. They hand it to me out of a bin when I say my name.
Right. It's very transactional, isn't it?
Yes, very transactional.
It's different. The further you go into more international markets, the role of the pharmacy becomes more and more central to delivering primary health care. And actually, we found that even in the U.S., where pharmacies, I would say, are underutilized in terms of delivering healthcare, there's a role for technology, there's a role for innovation to try and improve their service quality. But certainly in markets like Nigeria, and it's true all across Africa, it's true in South Asia, it's true in South America, that pharmacies have this very central role to play in delivering healthcare. And we feel that actually thinking about the needs of a pharmacy and bringing technology to bear there has tons of potential for making the world a fairer place.
How are you using technology now?
Yeah, so we do a couple of things. Firstly, we help pharmacies with their inventory management. So with ordering medicines from their suppliers, with keeping track of the medicines so that they stay on time, they don't expire. They're really important.
Well, adherence is such a problem. So it sounds like by being so integrated into the community, you're helping people adhere more to their prescriptions.
That's exactly right. So, we help on the back end around inventory management, but you're absolutely right. Then when the patient buys the medicines, they have to take them on time and they have to take them all the way to the end of the regime so that they can come back and actually, take the next dose. And so we help with things like automated texts, reminders to patients, and then actually just allowing the pharmacists to take the right notes as they are giving the drugs out to the patients, so you can track over time how people are performing, how people are doing, and give them the right advice.
So what's next? Where are you expanding to in this amazing impact that you're having?
So it's been a great year for us. This year we grew to 4 stores. We launched our MVP, our initial version for our software, in our own stores, and we've created a program or suites of programs to go to third-party pharmacies. So not just to support our own stores, but to support the whole industry, the whole pharmaceutical industry. And so in 2020, we're really trying to take that to the next level. We'd love to have hundreds of pharmacies using our software, using our initiatives, and touch thousands of lives every day through our network. And so that's the vision for the year, and we're super excited about that.
Bryan, thank you so much. I'm so impressed with what you're doing, and you are really making a difference, and you are a true health transformer.
Thank you. I really appreciate being here, Saranne.
Thank you.
Take care.